Fever in adults is defined as an elevated body temperature, typically above 100.4 degrees F 38 degrees C. It is a common symptom that can be caused by various conditions, ranging from mild infections to more serious illnesses. Fever is often the sign that the body is fighting an infection or other inflammatory processes. Causes of fever in adults: infections. Viral infections, such as the flu, common cold, or COVID-19. Bacterial infections, such as pneumonia, urinary tract infections, UTIs or cellulitis. Fungal infections, although less common, they can occur, especially in immunocompromised individuals. Inflammatory conditions. Rheumatoid arthritis, an autoimmune disorder causing joint inflammation. Lupus, another autoimmune disease that can lead to fever. Medications. Drug fever. Certain medications can cause a fever as a side effect or allergic reaction. Heat-related illnesses. Heat exhaustion, caused by prolonged exposure to high temperatures and dehydration. Heat stroke, the more severe condition requiring immediate medical attention. Chronic diseases. Cancer. Some cancers can cause fever, particularly if there is an infection or if the cancer affects the immune system. Endocrine disorders. Conditions like hyperthyroidism can sometimes present with fever. Post-surgical or post-trauma. Postoperative fever, a common occurrence after surgery, often due to the body's response to trauma or infection. Miscellaneous causes. Travel. Exposure to new pathogens during travel can lead to fever. Unknown origins. Sometimes, fever persists without an identifiable cause, known as fever of unknown origin (FUO). Symptoms associated with fever. Besides an elevated temperature, fever may be accompanied by chills or shivering, often experienced as the body tries to regulate temperature. Sweating. As the fever breaks, the body may sweat to cool down. Headache, commonly associated with fever. Muscle aches, often related to the underlying cause of the fever. Weakness or fatigue, feeling generally unwell or tired. Loss of appetite, reduced desire to eat. Diagnosis. To determine the cause of a fever, a healthcare provider may perform medical history, discussing recent travel, exposure to infections, medication use, and any other symptoms. Physical examination, checking for signs of infection or other underlying conditions. Laboratory tests, blood tests, to identify infections, inflammation, or other abnormalities. Urinalysis, to check for urinary tract infections. Cultures, to identify bacterial or fungal infections. Imaging studies, X-rays, CT scans, or MRI, to investigate possible sources of infection or other underlying conditions. Specialized tests. Depending on symptoms and initial findings, additional tests may be performed. Treatment. Treatment for fever depends on the underlying cause. Medications. Antipyretics. Medications such as acetaminophen, Tylenol, or ibuprofen Advil can help reduce fever and alleviate discomfort. Antibiotics. If a bacterial infection is diagnosed, antibiotics may be prescribed. Antiviral or antifungal medications, if a viral or fungal infection is identified. Home care. Hydration, drinking plenty of fluids to stay hydrated. Rest, allowing the body to recover. Cooling measures, wearing lightweight clothing, using a fan, or taking a lukewarm bath. Addressing underlying conditions. Treatment for chronic diseases, autoimmune disorders, or other conditions that may be causing the fever. When to seek medical attention. Seek medical attention if the fever is persistent or lasts more than 3 to 5 days. The fever is very high, above 104 degrees F or 40 degrees C. Severe symptoms accompany the fever, such as difficulty breathing, chest pain, severe headache, or confusion. There is an underlying health condition that could be exacerbated by fever, e.g., heart disease or diabetes. Signs of dehydration, such as dark urine, extreme thirst, or dry mouth. Conclusion: fever is a common symptom with many potential causes, ranging from benign to serious. While it often indicates that the body is fighting an infection or other issue, persistent or very high fevers, or those accompanied by severe symptoms, should be evaluated by a healthcare provider to determine the underlying cause and appropriate treatment. Managing fever typically involves addressing the underlying condition, relieving symptoms, and supporting the body's recovery.